instead of growing straight, the child grows crooked. In India, the awareness of scoliosis early detection is lacking. Low back pain is a major health problem. At least in a place like Bangalore, it is an epidemic.
Did you know that according to studies, a sedentary lifestyle can lead to a higher risk of scoliosis? And scoliosis is not a very common disorder. Only around 2 to 3% of the population worldwide are diagnosed with this issue. Such a low percentage is another reason why its awareness is also compromised. Scoliosis is a lateral deformity of the spine in which the normal spine curve takes an S or C shape when viewed from the back. It mostly affects adolescents between the ages of 10 to 16 years. Scoliosis is not a disease, but it is a condition which can be classified as both mild and severe. In this video, we'll break down what scoliosis is all about, how it's diagnosed, and the treatment options available with Dr. S. Vidyadhara, Chairman and HOD in Spine Surgery and Consultant Robotic Spine Surgeon of Manipal Hospitals in Bangalore.
Scoliosis is a painless condition. It occurs commonly in the children, more commonly in the age group of 10 to 15 years of age. It is progressive. Instead of growing straight, the child grows crooked. It affects the lungs and the heart as it progresses more and more. If picked up early, it can be treated with brace and exercises. However, in India, the awareness of scoliosis early detection is lacking because we do not have a school screening program unlike the West. The scoliosis, if it is detected between 25 and 45 degrees, it can be treated with brace and exercises. And if it is going beyond 45-50 degrees, you need to resort to surgery as the last stop. And surgery in today's world for scoliosis is as safe as anything else because we have the technology inside the operating rooms like multimodal neuromonitoring. You have robotic spine surgery as the last step. The robotic spine surgery in deformed spine makes you more and more confident inserting implants into the spinal column and then correcting it using force. These surgeries were dreaded. In 1980s, the success rate was 50% and now we are talking about 99.8% accuracy and safety. The patients are going to get benefited from robotic spine surgery in almost all the conditions pertaining to the spine and the spinal column, and it is here to stay. And with time, if more competitors come into the market and the price comes down, I think it should become eventually the norm for doing any spine surgery across the country and across the world.
Hi, I'm 14 and about 3-4 years ago, my parents discovered that I was standing in a weird posture, but this was the start of the lockdown, so we didn't take much action against it and we just thought it was because I was sitting for long hours during online classes and things like that. Then after COVID, after the lockdown was over, my posture continued increasing and became worse and worse. And so we went to a physiotherapist and I was diagnosed with scoliosis. And then I started the regime of doing physiotherapy every day and bracing. I used a Boston brace for about 19 to 20 hours every day. And I did physiotherapy at least twice a day, and that was when I started. So after the lockdown ended, I got a couple of x-rays and the degree of curvature in my spine was about 45 degrees. So the exercises and bracing helped keep it stable at that. It didn't increase, but also didn't help decrease the curvature. So we met Dr. Vidyadhara this year, and the start of this year in Manipal Hospital, and he explained to us the entire process of the scoliosis surgery and how it would go and the recovery time and everything. And I was quite scared in the beginning because it's a huge surgery, and but at the end of it, I was walking that same day and I'm on the track to recovery. I've again started physiotherapy to regain my flexibility and strength. And yeah, balancing the therapy with my school life because I'm in 9th grade. It was slightly tough in the beginning, but now it's become a part of my daily schedule, and it's also helped with fitness and things like that. We did meet a lot of doctors in the beginning. We went to a doctor in Coimbatore also, and that's when we first got to know that I actually need surgery, like it was definite. And then my parents did more research about really good scoliosis doctors in Bangalore, and the first name that popped up was Dr. Vidyadhara in Manipal hospital. And one of the perks was that it was very close to my house. And yeah, so that's when we started. We met Dr. Vidyadhara, and yeah, he told us about the entire process. And he was very forthright with all the information, and he refused to actually talk to my parents. He only wanted to talk to me, and he was very free with information. He gave me all the facts and all the details. He told me all the gory details, like every single detail of the surgery and how it would go. And I was actually more comfortable after that. And now after the surgery, I'm much better and on my track to recovery.
Is a 14-year-old girl presented to me a year back with progressive deformity of the back with no pain. They had tried brace but without effect, and when they chose surgery as the last option, I reassured them that it is the way forward and it has to be done the right way with use of robotic technology. She is a dancer, she is a basketball player, and after surgery we can promise her that she can do everything that she wants to do with no restriction whatsoever. I think she is a very brave girl to come here and talk about her journey with scoliosis, with conservative treatment, and finally surgery when it was needed. I think robotic has added a third dimension to the treatment of scoliosis compared to conservative surgery and robotic spine surgery. I wish her all the very best. Low back pain is a major health problem. At least in a place like Bangalore, it is an epidemic. Every other person has a back pain, whoever has a back. And more so because we are all used to sedentary lifestyle and we are faced with a lot of mental stress and strain. A combination of physical and mental problems causes back pain a household problem. The treatment should also be directed to both physical and psychological components, and in this regard, I would consider yoga to be the best, because one Surya Namaskar, all the backbones move, the joints move, and they move full range of movement. And also, if you know the right breathing pattern during the yoga postures, I think it helps reduce the stress and relax the mind. So body is a combination of sync between the mind and body is more important, and the earlier you realize, the better it is. And to add to this, the last point is our diet. A lot of people today, especially in IT professionals, don't go out in sunlight, don't drink milk, and they are faced with the problem of vitamin deficiency, which can also cause back and neck pain. So test your vitamin levels, take supplements. If you cannot, go to the sunlight.
Whether you're just learning about scoliosis or supporting someone who is dealing with it, I hope this video has provided some valuable insights. And remember, early detection and the right treatment can make a big difference. Thank you for watching, and if you found this video helpful, don't forget to like, share and subscribe for more health and wellness content. This is Mandira and you're watching India Today SoSouth.